One of the common questions that patients ask me is, how can I have prostate cancer if I don't feel anything? I don't feel like I'm having troubles urinating, it doesn't hurt, and how can I possibly have cancer? And the answer is because prostate cancer routinely does not have symptoms, certainly in the early phases. And I explain this to people because they have to understand what happens with prostate cancer. So if you look at the prostate, it's, for lack of intensive purposes, it almost acts like a donut around the urine channel. So a man will urinate right through the middle of that donut, right? So that prostate cancer tends not to grow on the inside part of that donut. So if it doesn't grow on the inside part of that donut, what happens is, and you're urinating right through the inside of it, you tend not to feel if there's anything wrong. You're peeing in the middle of a donut and everything's going great. So the prostate cancer is on the outside, right? On the outside of that donut where it's actually not squeezing on the urine channel. So in the early phases of prostate cancer, routinely you don't feel it. Some men actually will start seeing some evidence of erection issues, although that continues to be debated, because on the outside of the prostate and along the sides of the prostate is actually where those nerves are located. And what we do see sometimes is that men actually start having some erectile function issues, and then, concurrently what we do is we work them up and try to figure out could this be a testosterone issue, or is this something else going wrong in that prostate? And what we do find is they either have a nodule where we can feel a bump on the prostate, or that PSA is elevated, and then we find prostate cancer. So there's not a direct one-to-one correlation between erection issues and prostate cancer, but there is the potential that if you have prostate cancer that's pushing up against the edge on that, that can cause a potential inflammatory response. But to go to my original point is that you won't have, or you tend not to have, symptoms from that. You could have problems with urination where you feel like you have a slow urinary stream, you're getting up at night, you get this urgency and frequency, you're in meetings and you're getting up every 20 minutes and you're driving everybody bananas, but that tends not to be related to prostate cancer. What is that related to? Well, it very well could be related to what's called BPH. It stands for benign, non-cancerous, prostatic hyperplasia. So it's overgrowth of normal tissue of the prostate. It's sort of crowding in. Think of that donut that's sort of pushing in inside that urine channel. And then what happens, it becomes tougher for you to empty out that bladder. So two different conditions, and they can potentially be related. You could have BPH, but concurrently it just so happens that you come into our office and you chat with us and you say, geez, I'm having a tough time peeing. And at that time we say, you know what, I'm sorry, but we're seeing an elevated PSA. We need to make sure that we don't see cancer at the same time. But again, remember, just because you feel like $1 million doesn't mean that you don't have prostate cancer. It's very important. This is a very silent disease, certainly on the early phases. If we can find it on those early phases, and we can find it in its locally still confined within the prostate, the chance for cure on prostate cancer is excellent. If we wait until this prostate cancer becomes symptomatic, meaning that you start having urinary symptoms, or maybe you start having lower back problems, what that means is that this prostate cancer has potentially spread outside the prostate, and it becomes much more challenging for us to treat that. It's all about finding cancer early and treating it appropriately.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.